This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. When was the last time you ate inside a restaurant? For me, it was Valentine's Day. Since the shutdown, my family tries to order out once a week to help local restaurants in our town. If you do this too, is it enough to keep restaurants afloat? Probably not. So what's the fix for an industry that not only feeds us, but employs tens of thousands? Today we talk about Connecticut restaurants now that Governor Lamont has rolled back statewide reopening plans from Phase 3. How will a curfew for restaurants affect their bottom line? We want to hear from you too. Have you tried indoor dining? Why or why not? You can join us, 888-720-9677. That's 888-720-WNPR. You can share a comment on our Facebook page or find us on Twitter at Where We Live. Coming up, we talk to an epidemiologist about safety measures restaurants are trying, like so-called igloos. We'll explain. But first, on Zoom, joining us is Scott Dolch, Executive Director of the Connecticut Restaurant Association. Scott, welcome to the show.
Thanks, Lucy. Thanks so much for having me this morning.
So just on Friday, the governor modified the state's reopening, rolled back some guidelines and rules, and now we've got new restrictions impacting the restaurant industry that we haven't seen for a few months. How does this rollback impact your industry in particular? Can you walk us through these rules and what you've been hearing from your members?
Sure, Lucy. So obviously everyone knows in Connecticut we've had a little bit of an uptick in cases, and we're trying to, as I work tirelessly with the governor and his staff on opportunities and ways to continue to stay open, keep our businesses afloat. Obviously, the public health and safety is our number one concern as an industry, and it has been since the beginning. So on Friday, we went back to what they're calling a modified phase 2.1. So our restaurants were up to 75% capacity. They got to go back down to 50% capacity. Private events that are controlled by a commercial venue or a caterer or a restaurant have to go from 100 inside down to 25, and outside from 150 down to 50. Residential events at people's homes, things like that, inside, outside, both have been brought way down to 10 for those gatherings. And then obviously you mentioned the curfew. So there's a business curfew, not just for restaurants across the board, that businesses have to be closed by 10 p.m. And stay closed until 5 a.m. 7 days a week with this phase 2.1. So a lot of different changes and challenges that our industry is having to face to try to stay afloat as we head closer now into the winter.
You mentioned that you and your association have been working with the governor's office on guidelines for restaurants. So let's talk about the curfew. Did this throw you for a loop, this idea that first restaurants were to close their doors by 9:30, and now that's been changed a bit? But how does that impact restaurants when we think about the number of tables that are turned in a night?
It definitely, I won't say it threw us for a loop. Obviously, there's been some other states that have put curfews in place. I think it was a little bit of a shock to start at 9:30. Obviously, it got moved to 10 o'clock in line with Massachusetts. We are pushing the governor, the administration, Commissioner Lehman. Our ask right now is to try to move that kind of closure to 11 p.m. At least 3 nights a week, Thursday, Friday, and Saturday. And the reason being, and I think you mentioned it a little bit, Lucy, and for listeners listening in, our restaurants, especially our full service restaurants, you're going to hear from one in a second, are so tight on the weekends, especially in the winter, with how many turns they can get at their table. And a turn is every time, a group sits at a table, then the next group comes in. So that would count as a turn. Typical restaurants, try to get at least, if they can get 3 turns on a Thursday, Friday, or Saturday night for dinner rush. So you think of a 5 o'clock dinner, a 7 o'clock, and then around 9, depending upon the tables and the size. The challenge even with 10 o'clock is that 9 o'clock seating, and obviously rolling back to 50% capacity, you're limited in how many tables you can use in that 5 and 7 o'clock window. So that 9 o'clock turn is so important, not only to the business, but also to the employees. Those servers and bartenders rely on, that third group for tips. And even sometimes it's only maybe 2 turns in certain locations around the state. So, we don't want to penalize the good actors, the restaurants that are doing it right. We've kind of gone back to the governor and said, listen, we won't allow anybody into the restaurant after 9:15. Let's say everyone has to be seated and having their meal, but allow that kind of 9 o'clock dinner opportunity for our restaurants, to survive, because in a sense, you're losing a third of your revenue on the most busiest nights in the winter, when you can't have outdoor dining, because we know that's going to go away very shortly. And every little bit helps. They're really on their last leg. It's such a dire situation for this industry across our country, but obviously in our state. So I think that we're hopeful, as we continue to talk through this, that there'll be an opportunity, hopefully, to extend that curfew to 11.
You mentioned the good actors, but let's talk about the bad ones, and that's why the governor has imposed this curfew. There have been cases of certain venues that are flouting the rules. They're having packed parties. We know that COVID cases are growing in our state. I think I just saw a headline from the governor's presser yesterday that hospitalizations are at their highest since May. And so how do you respond to these venues that have not been paying attention to these rules for the public's health?
Yeah, I couldn't agree with you more, Lucy. As an association, we don't condone any of the bad actors, I think, and I've told that to the governor really since day one back in March, when we started, the shutdowns, and what you're looking at and what some of the media are highlighting really aren't, in my opinion, really restaurants or full service restaurants by any stretch. I mean, what we saw in Bridgeport, what we saw in Hamden on Friday, these aren't restaurants. These are nightclub that obviously, are what the governor likes to say, bars masquerading like restaurants. There's no food being served. No one's wearing masks. There's so many guideline when you see some of these videos and things that they're not following. You could probably go down a laundry list of guidelines, and that's where it's very frustrating for me, because situations like that are ruining it for the restaurants that have been following and working so hard to keep people safe, to keep their businesses open. And, and obviously it's a small few, but really in our industry specifically and with our members, we preach and we pride ourselves on these guidelines, because understand, and I've said that to everybody, that these guidelines are worked in conjunction. We've had a seat at the table, whether it's been tweaks to, as we'll mention, igloos and greenhouses to allow those, or, bar seating, but with restrictions, or, all different mandates and things throughout this pandemic. We continue to have that seat at the table to help work on guidelines that continue to keep guests safe and employees safe, but also allow our businesses to stay open, give them an opportunity to still generate the revenue to make it through this pandemic.
This is Where We Live. Today we're talking about the restaurant industry. Now that there's a surge in COVID-19 cases in our state, the governor has modified reopening plans, rolling back from a phase 3. And we're talking with Scott Dolch, who leads the Connecticut Restaurant Association. You can join our conversation. We want to hear how you're still visiting restaurants in the town you live, some of your concerns about whether it's eating indoors or even outdoors. The number 888-720-9677, or find us on Facebook and Twitter at Where We Live. I wanted to welcome onto the show now Andy Rizzo, who is a managing partner of Salute, which is a staple in downtown Hartford, right near Bushnell Park. Andy, welcome to our show.
Hi, Lucy. Thanks for having me on.
So we were hearing Scott talk broadly about the industry. You've been involved in the restaurant industry for many years. What does it look like for Salute these last few months, and what does this rollback mean for you?
It's a huge struggle down here, Lucy, to tell you the truth. It's very difficult not having any commuters back into town. It's very difficult with no events going on, no theater going on, anything like that, anything to bring people to downtown Hartford. It's non-existent right now. Whether it's a convention in town or something going on at the XL Center, Yard Goats games. So not having any of that down here, it definitely makes it a really, really big struggle as right now. The rollbacks, just when you think you're kind of gaining a little bit of momentum, that was definitely a tough pill to swallow, where we're getting basically punished for a couple bad eggs that have been ignoring the safety guidelines and everything, the mandates that the governor has put out, where we have gone, I believe, above and beyond safety protocols to make sure that our guests have a good experience, but also that they feel safe whether they sit inside or outside at the moment.
Andy, you mentioned the momentum. So tell us when your restaurant reopened this summer after the peak. And we've been having really nice weather lately. And so I imagine that business has been looking good, but we know winter is right around the corner.
We actually shut down for 4 months, Lucy. We closed on March 16th, and we reopened on July 16th. We were able to retain our entire staff, which that was big bonus for us and a big plus for us. We wanted to make sure that they were all taken care of. Warm weather has been great. The rollbacks, I think the public's perception that when he opened it up to phase 3, saying 75%, I don't want to say people got loose, but I think just the perception of it is like, oh, wow, maybe it is okay for me to go sit inside, still being 6 feet apart, still being socially distant and adhering to all the guidelines. And then that rollback, I think it just didn't go back one step. I think it went back several steps from people's perception right now.
So tell me more about that, this rollback and what you're hearing from people, because how many people can you really have in your restaurant, and how much of your area, the outdoor dining, have you been able to also fill tables?
We can seat about 120 inside, so at the moment we can do 60. Outside, we have 15 tables, all socially distant apart, which we kind of expanded our patio a little bit. The city of Hartford allowed us to do that, kind of push it out to the sidewalk. That definitely helps. The weather obviously definitely helps. It's kind of the Monday through Thursday, the corporate business that was always kind of lively down here, where there was energy in the city, people walking around. That's just, it's non-existent right now. So the struggle is really during the week. On the weekends, and I think I can probably speak for the majority of the restaurants in downtown, the Fridays and Saturdays are still good nights. But that definitely doesn't make up for the rest of the week, the Monday through Thursday business. Your draw right now yourself is yourself in downtown Hartford. People come to see you. People come to grab your food. We are getting new faces in here, but the majority of our customers are repeat customers, loyal customers, friends, family. The travelers that would be coming through Hartford, obviously they're just there. It's not there right now. So that's the big struggle is during the week right now is really, really tough.
And what does this curfew mean for Salute?
That was another kind of rollback for us, where not that we used to be a great late night place after a Bushnell show on a Friday. People know that they can come in here at 10, 10:30, 11 o'clock and get a full meal. After a UConn game, after a Yard Goats game, people knew that we were one of the restaurants that we stayed open pretty late to feed people. With all of the COVID and everything going on, we just don't get that anymore. So we don't really get those late night diners. But as Scott was saying, we don't get that extra turn on a Friday and Saturday, where for us that is just huge. We can't exactly seat people at 9 o'clock and expect them to have a decent dining experience when we're kind of just throwing food at them and saying, sorry, you have to be out in 45 minutes, when they just got a nice meal, a nice bottle of wine, and are out supporting you and spending their hard-earned money to come and support you. And it's very difficult to give them that experience that they deserve going out later on that time.
You're hearing Andy Rizzo here on Where We Live. He's managing partner at Salute, which is an Italian restaurant in downtown Hartford, right near Bushnell Park. You can join our conversation, 888-720-9677. Jane's calling in from Simsbury. Jane, you're on the show.
Hi, thanks for taking my call. And more of a comment than a question. Just since the pandemic started, we did take out every chance we could to help support local businesses. Then ate outside as possible, and then also ate inside. I wanted to comment that every restaurant, including Salute, has made us feel very safe in what we do. With our family, with the social distancing that they practice inside. And while we're disappointed at the curfew, it is understandable, because what we can do to stop the spread while still supporting our businesses, we're all for.
Well, thank you, Jane, for calling in. I wanted to talk more about the takeout revenue because so many of us are trying to do that where we live. Andy, have you seen that grow, and how much of that of your revenue is from takeout?
Yes, we definitely have seen it grow, and we've been trying to do different options, give people kind of options like a family 4-pack, because we know the majority of them are going back home and feeding their family if they are in the city and leaving the city to take something home. Our takeout has been up about 15-20%, which is fantastic for the business. That's great, but it doesn't necessarily equate to taking care of my staff. And I'm not saying people aren't very, very generous and tipping and gratuities to our staff because they understand what they're going through. But the bottom line is we need bodies in the seats, whether it's inside, outside. Outside, obviously, right now with the weather is a lot easier than seating inside. But when we do have those days where all we have is indoor dining, you can definitely see the pullback from a lot of people that are not comfortable, not just because of us, just in general, are not comfortable going inside, and you totally understand that. So for us, it's more so we really want to put bodies in the seats, and we appreciate everyone doing takeout. Believe me, it's been a huge kind of just to not even get us over the hump, just to get us to the top of the hump where we can kind of sustain business right now. But our big thing is the next couple months, especially with the winter months, is really to get bodies in the seats and really, looking for support from the state, on a state level, on a federal level. The PPP was fantastic and that was great, but for me, that was pretty much a Band-Aid on a really big cut right now, where that definitely helped out and helped you sustain for those 24 weeks. But now coming into the winter months and the uptick in cases, everyone's kind of worried again, and we don't want to have to roll back any further than we are right now.
Scott Dolch, you're still with us, Executive Director of the Connecticut Restaurant Association. Are you hearing that also from other restaurants that, takeout, it has been a benefit to have, but it's just not enough? They've got to have people coming to the restaurant and sitting down and having a meal.
Yeah, Lucy, exactly. I mean, Andy obviously is speaking the truth to kind of what I'm hearing. Obviously, most in normal times, pre-COVID times, takeout is anywhere between 8, 10, maybe 15% of a full-service restaurant. They've had to adapt, which Andy and Jimmy at Salou have done, to do family meals for 4 and different ways to be creative throughout this pandemic, which I applaud them and so many restaurants to make it easy. I think we're all tired of being in our house and trying to cook from home and giving them an opportunity to cook much better meals. But at the same time, to Andy's point, it is a worry. I mean, and you talk about, is that going to sustain? Is it 20, 30, 40% of really the revenue? When you go back to the 2 months of our full shutdown that we had back from March 16th to May 20th, and how much debt was built up, and the challenge of, and Andy hit the nail right on the head, that the staffing concerns are huge for us. My concern right now is, we had September numbers that, I talked to a couple media folks saying, hey, we had an increase in employees in our industry, like a 7% decrease in unemployment specific to our industry, which was great. But I said, let's not get too excited because we know that winter is coming. And while you had all that outdoor seating and able to bring staff back, a lot of restaurants are looking at their numbers and saying, do I have to furlough or lay people off again, which is the last thing we want to do. We don't want to have to do that. And I think to Andy's point, we have to figure out other ways creatively through a state and federal level to help us, make it through, not only for the business side, but for the employees as well.
Scott, talk more about the impact on our state when we think about nearly 1 in 10 Connecticut residents work in this industry. What's at stake if we can't figure out a way to help restaurants stay afloat?
Yeah, I mean, if you look at a bigger picture, I mean, just so everyone knows listening in, our industry did $8.9 billion in the state in 2019. We had 8,511 restaurants. Unfortunately, we do not have that currently. We had 160,000 food service employees, just specific to Connecticut. And when you look at some of the trends or national numbers that are out there, they're saying, the New York Times is saying that, 25 to 30% of restaurants across the country will not make it to 2021. if that's an accurate, projection, we'd be looking at losing 2,000, 2,100 businesses, small businesses in our state. And, what that means to the business themselves, the employees for that business, the ancillary businesses that are affected by restaurants, whether you're looking at, linen companies, food purveyors, liquor distributors, all the people that rely in their businesses so driven by restaurants will have an impact as well. And, obviously the community, downtown areas, thinking of Hartford, specifically with Andy's situation, if we were to continue to lose restaurants, what downtown will look like coming out of this pandemic. So there's so much at stake here and of what could happen. We know that over 600 restaurants in Connecticut have already either permanently closed or do not have a date currently for reopening. And that number continues to grow. And obviously, I know we're going to talk to Gregg from trying to flatten the current curve of the rise. I also have a second curve I rely on every day that I worry about is the curve of loss of businesses and loss of restaurants. And I'm trying to do everything I can as an association to help these restaurants not have to make that terrible decision of, we just can't make it anymore. We're going to have to shut down our business and unfortunately close our doors. And that's what I'm stressed about. I lose sleep at night because I know, these people have put their lives into these businesses. And they're trying to do everything they can. They're fighters. They're trying to survive, but they're going to need additional help and support, to make it through the next few months that are upon us.
That's an important point. I want to go back to Andy Rizzo of Salud. When we think about your restaurant surviving, being able to keep your workforce, but if restaurants around you are closing, that really impacts your business as well.
Absolutely. Definitely, Lucy. We're a big family in downtown Hartford, honestly, with everyone. It's not just us. We think about everybody else in downtown Hartford. We're a very, very close community down here. All the owners, all the managers know each other. We all talk. We all feed off of each other's business when things are going on down here. And right now, that's just really tough. And it's really tough to just try to keep everybody positive. That's the big thing for us is just trying to think of everything on a daily basis, something positive coming out of this. Like I said, we have 40 employees, and they all came back. We do not want to make any layoffs. These are people with families. That this is how they support their family. They have children at home that they're homeschooling now. Their significant other, or wives or husbands, they can be laid off also. So for us was really, really, really important for Jimmy, myself, and our chef, who's the other partner, to really maintain our employees. And I think with that also comes the safety, where people come in here and they see the familiar faces, they feel more comfortable, they feel a little bit more like they're at home. The majority of our employees have been with us forever. So one big thing for us is able to have all of our employees back and really trying to support them as much as possible, because we do have some lifers in this business that have been with us for 10, 15, 20 years, even before we had Salute. And like I said, they have families to support too. So we're not only looking out for ourselves, but on a daily basis, we're definitely looking out for every single one of those employees that will make sure that they can put food on their table and make sure that they can sustain a roof over their head through this pandemic.
Andy, what do you want to hear from Governor Lamont?
I really liked what he said a couple weeks ago, where he came out and said with his own words that it is the uptick in cases has nothing to do with restaurants, has basically to do with gatherings. And like I said before, there's just those couple bad eggs that really make a bad name for our entire industry, where a lot of us are going above and beyond. I would love for him to come out and say, please go to downtown Hartford, support downtown Hartford, even though nothing is going on. We would love for him to come out and say something like that in the public's eye and let people know that it is safe to sit inside these restaurants that are social distancing. And that's really it. It's just really getting bodies in the seats at the moment, and especially through the winter. I think it's going to be a really long winter. We really do down here. But we're going to survive, and a lot of these other places, hopefully they do too. We do not want to see anybody else go out of business in downtown Hartford, and for more so for the entire state of Connecticut. But down here, I have friends in the restaurant industry. I've talked to Scott many times about different restaurants around that have closed, whether it's surrounding areas in Hartford or down the shoreline. and everyone's everyone's struggling. It's really tough, but I think the hardest hit is in the cities, where they rely on that corporate business and they rely on the commuters to go down. And I would love for Governor Lamont to come out and say that, please, it's okay to go inside restaurants. He's actually been here twice, and he has sat inside. So.
Well, Andy Rizzo, thank you for calling in to the show today, managing partner of Salou in Hartford. We appreciate your time.
Appreciate you, Lucy. Thank you very much, and thank you, Scott.
Scott Dolch is also with us. He's going to stick around, Executive Director of the Connecticut Restaurant Association, as we continue to talk here on Where We Live about how to support local restaurants in this pandemic. Do you feel comfortable eating indoors? We'll talk about some measures restaurants are taking right after the break. We'll also hear from an epidemiologist. You can join us too. 888-720-9677. That's 888-720-WMPR. And you can find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Last Friday, the governor rolled back Connecticut's reopening because the number of COVID-19 cases and hospitalizations has grown. This means restaurants and other businesses have to follow certain guidelines, like a 50% capacity and closing at 10 p.m. With us on Zoom is Scott Dolch, Executive Director of the Connecticut Restaurant Association. And joining us now is Gregg Gonsalves, Assistant Professor of Epidemiology at Yale School of Public Health. Gregg, welcome to the show.
Thanks for having me, Lucy.
So many of us are wondering about, is it safe to eat indoors? And when we think to the start of the pandemic back in March, there's a lot of attention on how this virus spread. So what do we know at this point? And can you shed some light for our listeners about, is it safe to eat indoors at restaurants?
So first of all, risk is on a continuum, right? Like safe, unsafe is not the way to think about it. It's thinking of things as more safe or less safe. And so being outdoors and eating outdoors in a setting where, perhaps there's an overhang, but there's fresh air flowing through the venue is probably the safest way to enjoy going out to a restaurant at this point. Again, with tables spaced accordingly 6 feet apart. As we move indoors, risk increases, right? It increases with the number of people that are in a given set up in a restaurant. It increases depending on the kind of ventilation that's available within the establishment. So things can be done more safely or less safely. And as the overall community spread of the virus increases, risk increases as well. So the restrictions that you're talking about being reinstituted in Connecticut are not about what the restaurant business has done. It's about what the virus has done. And the virus has increased over the past few weeks, as Scott has hinted, largely from sort of small private gatherings. But we're seeing the virus go up. We're heading towards winter where things will get more risky. So we have to think about how to live more safely, which includes how we deal with bars and restaurants.
Scott Dolch, hearing Gregg explain that to us, when we think about how to reduce risk, talk about some ways that restaurants are thinking about that, because we know cases are going up in our state.
Yeah, Lucy, I think about, and obviously to Gregg's comment, that it's stuff that we preach and we see every day, our restaurants going above and beyond ways to keep their employees and their guests safe, adding new air ventilation systems, UV ventilation systems, with plexi and spacing out, the sanitation and cleanliness, that what they're doing above and beyond, to make sure that people see that and continue to promote that. It's obviously a different time than ever before in an industry where I don't think, you would ever put safety as the first, it's obviously about your food and your ambiance and what you provide in the service. But safety is everything. And I think, you're seeing restaurants getting as creative as they possibly can I was just at a restaurant last week, that was putting in a whole new air filtration system through UV, and the company, was saying that the way that the air flows, it's 99% cleaner than even the air outside and the way it moves. And I think that's what you're going to continue to see. These restaurants, obviously their livelihood, their business is at stake, just like other businesses around. Don't get me wrong. I mean, obviously to Gregg's point, there's a risk that we make in our lives every single day. And obviously there's a little bit of an increased risk now with the spread, but whether it's going to a grocery store, going to a package store, going to Home Depot, our kids going to school, my 3 kids being in school right now, there are definitely risk, but I do think, our restaurants continue to do what is asked of them, but also not even what is asked, to going above and beyond. And you're seeing that. And I think, I applaud them, and I think they're just trying to do everything they can to survive this, and hopefully we can flatten this curve. We can see the other side of it. But obviously, with the winter months, outdoor dining, like we've talked about, is unfortunately going to go away, or at least versions of outdoor dining. There's some unique dining experiences we can talk about outside, but I'm hopeful that people understand there's no other industry that public health goes through their business 4 times a year in normal times. Our industry prides itself since this pandemic started that we need to be leaders in safety and sanitation. We have to figure out creative ways and work with local vendors and technology. We just can't sit around and go, okay, well, we're just going to have to wait it out. We have to continue to make our restaurants safer than they've ever been before. And you're seeing that right now. And you saw that even with outdoor dining, with how they set up their outdoor areas and kept people safe. And if you go inside a restaurant, I promise you'll continue to be pleasantly surprised by the efforts that the staff is making, that the restaurateurs are making to make sure you can feel safe eating inside.
Luis is calling into the show from Westchester, New York. Luis, welcome to the show. How do you feel about dining at restaurants these days?
Hi, thank you for having me. It's a really good question to ask. I think, around June, New York got hit really hard, and I think around that time, Connecticut allowed indoor dining. So we started to shift to Connecticut. We started dining in Connecticut, lower populated areas. Now that the cases are on the rise again, obviously safety is a concern for me and my family. We want to support restaurants. So I think we're going to be shifting a little bit more towards the dining out, takeout. We're trying to actually make sure that we order at the restaurant as opposed to some of these third-party services that charge the restaurant's fees, which already makes it more difficult for them, to gain profits. We just hope that, we take it seriously and that we continue to walk around with masks when dining in. Sometimes I think we're forgetting just because we're still not used to it. We're getting more used to wearing the mask now. We're walking outside of our cars. Oh my gosh, what did I forget my mask? But we're forgetting that we need to walk around with our masks when dining in. I hope we continue to do that and push it. And we're just hoping for the best. We hope that small restaurants continue to stay open and afloat, that they figure it out and they push more towards takeout dining during these colder times. But, I'm just really worried that it's going to be a time when it's really mostly franchises or big corporations or big companies that are only around, and a lot of these small restaurants aren't around because of COVID.
Well, thank you, Luisa, for calling in to Where We Live. You can join us too, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Gregg Gonsalves, we're hearing from restaurants that are trying these outdoor enclosures, but the importance, as you'd mentioned, is ventilation. What's your take on this?
So the reason we sort of think of indoor dining as higher risk is because it's enclosed, right? And there's little ventilation, and there's people in close proximity, right? So if you make a plexiglass or a tent igloo outside and recapitulate a less safe indoor dining experience, except it's out on the street or in the backyard or in the parking lot, you're sort of defeating the purpose of outdoor dining. The one thing I want to mention is that I think the restaurant and bar industry has been left on its own. We haven't seen enough federal support to help them do these things that Scott has said Connecticut restaurants have taken up on their own. I think Senator Murphy and Senator Blumenthal, Governor Lamont can do a lot more for small businesses in the state and help them to be able to weather the storm, whether it's providing economic support for the industry or PPE or other kinds of technical support will help us get through the winter together. But I think we just have to follow the sort of basic precepts of risk reduction and figure out how we can keep people as safe as we can over the winter. And it may move us towards, very restricted indoor dining. It may end up in additional reduced capacity. But I think it's not incumbent on small businesses and restaurants and bars in the state to do it on their own. This is about a public health crisis, but it's also a social and economic crisis. And we need our state, local, and federal officials to really start to deliver for the small businesses in the state. The previous pandemic relief bill was really targeted towards large corporations, not to the mom and pop businesses that Scott represents.
That's a really important point, Gregg. Scott Dolch, let's talk about that. This idea that government can't just come up with these rules or tell you when you need to close, but this idea of supporting workers and small businesses. What is Connecticut doing?
Yeah, no, Lucy and Gregg, thank you so much for bringing that up. I couldn't agree more. I think obviously our restaurants have been, really struggling for 8 months. I mean, it'll be 8 months here, the beginning of next week since the shutdown. And obviously federally, we received that PPP funding early on. It was a 2-month program. We've been in this now 8 months. So, to be able to help them now as we head into the winter, especially being in New England, as opposed to southern states and things like that. Federal, I'm hopeful cooler heads prevail down in DC and we can get another stimulus package that can target small businesses and the hardest hit. And I use that term very, very, the same way on the state level. I know that a lot of states around us have created, and even Connecticut has launched a $50 million grant program that Commissioner Lehman and his team has put together. And I applaud their efforts so far. But I do think our industry specifically, as a lot of states around them have created specific programs targeted at the hospitality industry, obviously restaurants and you look at breweries, you look at all the other, private event venues, caterers that have been hit so hard. I don't think there's another industry that has had to weather this storm like we have. And then obviously to have another rollback leading into the darkness here of winter. We do need that support. And obviously, I'm asking our state, through the CARES Act that was passed back in May, if there's an additional dollars out of the $1.38 billion our state received to go to the hospitality industry and a significant portion to helping. Because right now the program in the state is only offering $5,000 grants. I hate to say it, I just don't think $5,000 is going to help get any business in Connecticut through the winter. I think that, when you look at other states around, their maximum grant amount sizes are anywhere between $25,000 and $75,000, $100,000 in the New England states. So I'm hopeful as we continue to talk to the governor that money has to be spent by the end of the year, that we can continue to create a program. Because obviously to Gregg's point, we are, there's going to be, and even the caller, there's still a lot of concern now about going inside and eating. And we are going to continue to push to have as many guests that feel safe to go in and eat, but and hopefully they continue to support us through takeout and other ways. But at the same time, we need additional support. And I'm hopeful both on a state side, we can build a robust grant program for our industry. And then obviously, down in DC, as I work with our colleagues and our 7 delegates down there as much as I can to get an additional round of stimulus, as Gregg mentioned, targeted to the small businesses, to the restaurants, to make sure that we can get through this pandemic. The last thing we all want is to see one restaurant close more or less than hundreds or even thousands in our state, because the recovery and what it'll mean for the communities that we all live in would just be just such a difficult, and so hard. It's already been tough enough in Connecticut to open a business and run a business in normal times, and how long our recovery could be if we go back to 2007, how long it took Connecticut to fully recover and the GDP concerns we had last year. My concern is if we don't do more now, we're gonna put ourselves in a hole as a state. Long term, that is going to be very, very hard to come out of, and that's not what any of us want. So I'm hopeful that we can continue to work with both our state and federal officials to find some solutions that work for our industry.
When we think about the cases that are surging here in the United States and in our region, we can look to what's happening also in Europe. And so, Gregg Gonsalves, are there initiatives or measures that other countries are taking to deal with these surges and ways to support their businesses?
Well, I mean, I think you have to realize that the United States has had a very unique trajectory with this epidemic. And while Europe is seeing resurgence in cases across lots of countries, but they have a much more robust social safety net. and healthcare, and less of a fragmented healthcare system. And so there's an ability to catch people as they fall, whether they're individuals in our communities or they're small businesses who serve us night and day. And so I think the point is that many countries like Denmark have done direct salary subsidies and subsidies to businesses, not sort of one-time grants or small grants, or for individuals $1,200 checks. And so again, this is a public health crisis that the virus sort of dictates the terms on, but the social and economic consequences are something that we can deal with in a much better way in the United States than we have before. And we want to come out of this better than we started, right? And that means having our communities fully flourishing when this pandemic is over. And that's going to mean a really sort of a Marshall Plan for the United States, for small businesses, for individuals in our communities who are most vulnerable to this virus. And so other countries, New Zealand, Australia, others have been much more aggressive about social and economic support, testing, tracing, isolating, mask wearing, all the things that Scott and his member restaurants are doing on their premises. But we haven't sort of taken a sort of national campaign the way many other countries have to sort of confront the virus and its social and economic impacts. And we have to do better. And perhaps in January, we can start to change our trajectory on that. But we're going to have to get, again, Senator Blumenthal and Senator Murphy, Governor Lamont, at the table in DC, arguing for small businesses, arguing for relief to individuals in our communities who, if you're struggling economically, you're not going to go out to eat, right? And so the restaurants have to survive and the customers have to survive. And that's going to mean social and economic support far greater than the sort of small amounts that have flown down to local and state municipalities over the past 8 months.
You're hearing Gregg Gonsalves, Assistant Professor of Epidemiology at Yale School of Public Health. Scott Dolch is also with us, Executive Director of the Connecticut Restaurant Association. We'll be back after a short break. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. My guest today on Zoom, Gregg Gonsalves, Assistant Professor of Epidemiology at Yale School of Public Health, and Scott Dolch, Executive Director of the Connecticut Restaurant Association. Gregg, you mentioned earlier the importance of risk reduction or harm reduction when we think about how we're going to get through this pandemic. In the summer, it seemed easier to do. As we're thinking about colder weather ahead, what kind of approach should people take? How do they do that when they may be stuck indoors?
You're right. The summer was much more propitious and easier to do in terms of social distancing. We could be outside in parks. We could be in outside restaurants. As we move indoors, risk increases. In addition, this month is Thanksgiving. Next month are the December holidays, where people are going to have a deeper urge to go home and see family. And so we're going to have to figure out how to sort of minimize our social contact. And so, maybe we skip Thanksgiving this year and hold out for 2021. But if we feel like we have to see our families, it means trying to be able to get a COVID test before you get in a car and drive to see your elderly mother or father. It means quarantining if you travel across country on an airplane before you see your relatives. It means really reducing people outside your intimate social circle. You have to sort of constrain the risks among the friends and family that you're going to spend time with over the next few months. I think you can go out to get takeout. I think there's a possibility of outdoor dining as far as we can stretch it into the fall and early winter. And there's probably a possibility, depending on how the pandemic sort of goes over the next few months, for continued indoor dining, based on the sort of modifications that Scott has described that are happening all across the state in small restaurants, small and large restaurants and bars and other hospitality venues in the state. But it's not the summer. It's much riskier, both because of the climate and the ability to be outdoors, but also because the virus was at a sort of nadir at a lull in Connecticut during the summer and is now starting to go on the uptick. I wish this wasn't the case. But the most important thing to say is we shouldn't be told that we have to do this alone, and that we're alone against the virus, that we are sort of cast adrift, whether we're a small business or an individual family in this state. And we really need our political leaders to step up and catch us before we fall.
Gregg, many of our listeners have heard about pods or maybe have formed them, this idea of, trying to not be isolated. Again, can you talk about that approach and what's a way to do it, especially as we get to winter?
So, so pods are your family is a pod. It's your significant other, your children, your dog, or your cat. And the point is that you want to restrict contact with others to sort of reduce the sort of chances for infection being transmitted through one of you to the whole community that you live with. I've heard of friends in Connecticut and New York having sort of friendship pods where a group of 6 to 8 people say we're the only group of people we're going to see. If we leave we're going to restrict the ways we do our grocery shopping and do other sort of odd-type contacts. If there's any sort of significant contact with large groups of people, we're going to quarantine ourselves for 2 weeks before we come back into the pod. The suggestions around how to deal with the holidays are based on some of these precepts too, about restricting your contacts before you deal with other people. But I've also heard of neighbors becoming pods together. So like if you have kids and they have kids, in order to allow some sort of social contact for young people, families have decided we're going to be a pod and we're going to restrict our contact with the outside world. We're going to make sure that we are pretty rigorous about mask wearing, about how we sort of deal with others in the community. This is a crisis. It's a public health crisis, but it's a social crisis, and it's asking a lot of us. And it hasn't been easy these 8 months. And even if you work in public health, you're facing these issues yourself in your daily lives.
We're lucky for those of us who have families, but when we think about people who live alone, Gregg, that can also be challenging.
Yeah, my elderly mother lives alone on Long Island, and I talk to her, every couple of days, and I think the loneliness is acute, and there are people without family to call them. And this is where, we have to show some solidarity and generosity to our neighbors, even if we didn't meet them before the pandemic, and check in on them by the phone, or be willing to drop off groceries. And there's been these sort of mutual aid networks that have popped up across the country and across Connecticut. But I think we're going to have to think about how to rely on them a little bit more as the winter hits. I think people felt at liberty to sort of leave their houses, even if they lived alone, during the summer to take care of basic needs. During this winter, it might be a little bit more difficult to do some of that for people who live alone, particularly our elderly. And we're going to have to sort of step up as neighbors to show we care, as we wait for relief to come from our politicians for the support we need to do this on a wholesale level.
That's a good point to end on. Thank you, Gregg Gonsalves, Assistant Professor of Epidemiology at Yale School of Public Health. We appreciate your time, Gregg.
Anytime.
And Scott Dolch, thank you for joining us this hour to talk about how we can help our restaurants and the people who work in the industry who are our neighbors and family. Thank you, Scott Dolch, Executive Director of the Connecticut Restaurant Association.
Thank you, Lucy. Thank you for continued support in our local restaurants. They need it now more than ever. Thank you so much for having me.
Today's show produced by Carmen Baskoff. Our technical producer is Kat Pastor. You can download Where We Live on your favorite podcast app. I'm Lucy Nalpathanchel. Thanks for listening.